Good morning, everyone. My name is Adrienne Luckenbacher, and I'm the moderator for today's presentation, Addiction Compassion is Greater Than Stigma. I want to welcome everyone to the Opioid and Other Drugs virtual series provided by St. Clair County Community Mental Health in partnership with the Community Services Coordinating Body. This webinar is made possible by a grant that was awarded by SAMHSA, the Substance Abuse and Mental Health Services Administration. We're very excited to provide this continuing virtual series during the month of September, which is also National Recovery Month. I've also go through every time, and those of you that have joined us for other webinars, I appreciate your patience because we want to continue to share a few tips about different kind of housekeeping items, including CEs, to engage, make sure that we have a really engaging and interactive session today. And just FYI, this session is being recorded. We want to encourage you to first enter any questions and comments that you have during the webinar using the chat feature, which is found at the bottom of your screen. If time allows, we're going to do our best to answer any questions that we can at the end of presentation, again, if time allows. We hope that the chat box will serve as a very interactive space to share different strategies, ideas, maybe even resources that you have or where you work or the agency that you belong to related to our topic today. We're also going to talk a little bit about continuing education credits. Continuing education credits are offered today for individuals that pre-registered for continuing education at our registration. This session is also offered on Facebook Live, but we want to let everyone know that continuing education credits are not eligible for folks that tune in on Facebook Live or that watch the webinar after it's recorded. It's only for live viewing, only for the CEs. A couple of other things. When you signed on to the series, you used your full first and your full last name. If you didn't get a chance to do that, we need you to log out and log back in and put your full first and last. That's very important for continuing education credits. And if you could do that, we would greatly appreciate it. You must be logged in to the entire duration of the presentation for continuing education credits. Participants who are not logged on for the duration will not be able to qualify for continuing education credits. And if you find yourself for any reason just losing connectivity once, maybe twice, hopefully not at all during the session, just go ahead and log back in because we're able to see that and keep track and know that you logged back in, which is fine. Continuing education credits will be only provided to those who complete a short quiz and a short survey after this webinar. These materials were included in your registration email and must be completed within 7 days of the completion of the webinar today. This series also for continuing education credits will have an in and out code for participants, and participants will be entering this on the quiz. So today's in code is the word summer, all caps, S-U-M-M-E-R. Again, today's in code, and I would note that down, is summer, all caps, S-U-M-M-E-R. All right. Now we're going to move over to our presentation. Today, we are very excited to have Judge Linda Davis. Judge Linda Davis spent 13 years as an assistant prosecutor and chief of drug prosecutions for the Macomb County Prosecutor's Office before being appointed as a judge by Governor John Engler, March of 2007. After serving as a judge for the 41st B District Court for 19 years, she retired from the bench last year to become the executive director of Families Against Narcotics, also known as FAN, a Macomb County-based grassroots organization that she helped found in 2007. FAN raises awareness of the dangers of prescription narcotics and other opioids, and by supporting those affected by substance use disorders. Judge Davis has been instrumental in helping FAN grow into more than 20 chapters statewide. With that, I'm going to turn it over now to Judge Davis.
Thank you so much for the introduction. So stigma is something that is really near and dear to my heart. It is something that I think that we talk about in terms of people that are suffering from substance use disorder, but it actually is even bigger than that. So in general, stigma is a mark of disgrace associated with a particular circumstance, quality, or person. We always make the assumption that stigma around addiction is associated with a person that is actually suffering from the disease of substance use disorder. but it's very much more far-reaching than that, because it is also something that is felt by every family member. I want to talk a little bit about my background before we get into the meat of what stigma is all about, because I am the living, breathing example of what stigma is all about. You heard in my background that I was an assistant prosecutor. What you didn't learn is that my sole job as an assistant prosecutor for many years was to prosecute drug cases in Macomb County. And I truly thought that prosecuting those cases and locking people up, getting them off of the street, was what I should be doing for public safety. I had no education around addiction. I had no training about what addiction was about. And so I was left with my preconceived notions from watching television, from things that I had seen in society that gave me my perception of what someone suffering from substance use was all about. It was the guy on the street, the guy laying in a gutter, the guy under the bridge, the woman who had ratty hair and a needle stuck in her arm. And because of the education I received from social media, I oftentimes reacted to that particular circumstances or person with disgrace, almost disdain for who they were. I really never looked beyond that person to think about who they might have been before addiction became a part of their life. And I certainly didn't think I had any part in moving the needle on that. And I took those same attitudes into being a judge. Once again, judges do 85% of our work is substance use related, and yet we really are not mandated to take any education about addiction at all. So we come with all these biases and perceptions that are based on false information that we've received throughout our lifetime about what addiction is all about. Fortunately for me, that was something that changed because of my own personal experience. I'm sure many of you know, if you've ever heard me speak before, that I experienced addiction firsthand with one of my children. And it was the biggest education that I ever received. I know that back when I was going through this, I thought it was the worst thing that ever happened in my life. And I remember one of my child's counselors telling me that if you ever allow this to be, it will end up being a big blessing in your life. I couldn't understand how this could ever be a blessing in my life, because it was the most painful thing that I ever gone with. But it was through feeling stigma toward me that I really began to understand what I had done to so many people. And so that was really a painful awakening for me. But I also have to realize that we are a product of our environment. If we're never taught about a topic, we then are left to make false assumptions about it. We usually generalize as a result of the prejudice, avoidance, rejection, or discrimination. And TV paints an incredibly negative picture around the use, the word substance use disorder or addiction. And we still continue to see that to that day. So that has become one of my biggest challenges, and also undertakings with our organization to reduce stigma. I will tell you that, we look at these numbers that over 72,000 people a year in 2019 died of car crashes and gun deaths. And yet we know that more people die of addiction, and still we are carrying these false perceptions of what a person suffering from substance use disorder and their family are all about. So what does stigma do around substance use disorder? It does a lot of things, and we think of these, and I want you to continue to think throughout this presentation of not only the person that suffers from the disease, but also of what their family. I will tell you that when I was dealing with this with my child, I went through horrible stigma myself. I remember when I first took my child to the hospital for detox, and I had just learned that morning that she had a drug problem, and I was mortified by it and very frightened. I started making phone calls to a lot of substance use places that I sent people to as a judge. And I was really met with no compassion. People were cold and short. I heard numerous times that morning that my child was probably going to die because my child was using heroin, and it's a deadly substance, and people don't usually get well from addiction. And so I was having even stigma thrown on me by the actual treatment facilities that I was calling by help. But probably the biggest one that occurred during that morning was when I went to the hospital, and nobody there knew who I was. So I just showed up in sweats and no makeup. And I had been up most of the night dealing with what I was going to do next because I was unable to find any help. And I walked, once my child was comfortable, I walked out into the hallway to call my secretary to let her know that I was going to be taking some time off of work. And I heard a nurse and a doctor talking at the nurse's station about the pathetic mom crying over her junkie child. And I don't think I've ever felt that little in my life. And I knew that instantly I had something to be ashamed of and that I needed to keep a secret. I'm an elected official, or I was at that time, and I was horrified not only about what was happening first and foremost to my child, but secondly, whether or not I would end up losing my career over it. So this incredible burden laid on my shoulders. And for a long time after that, I never discussed this with anybody. And it wasn't until my neighbor, who was living next door to me, Fraser police officer, Lisa Pettis, and I were talking over the fence, and she said, "Linda, so many people are being affected by this in our community. We need to do something." I agreed to show up as the professional, the judge, but I was met in the basement by 100 families that were really suffering. Either they had suffered themselves from substance use disorder, or they were dealing with a loved one that was suffering. And I saw more tears and sadness in that basement than I think I've ever experienced in my life. And I knew that I was going to be a hypocrite if I stayed silent about that this was in my family as well. And so I began to share my story, and fortunately, it really resonated with people, and it lifted an incredible burden off of my shoulders. But I will tell you that initially I felt all of these things that we say affects people with substance use disorder. I quit hanging out with all of my friends. I was isolated. I would go to work, I would do my job, I would go back into my chambers as soon as I was done doing it. I didn't go to lunch with anybody. As soon as I was done with my docket in the afternoon, I went home, I laid on my bed, and I cried. I isolated something terrible. I felt like I had done something very wrong. I felt like if I had been a better parent, if I had been more, if I had done more, if I had been more, that maybe my child wouldn't be suffering the way she was right now. I felt ashamed. I would not tell anybody about what I was going through for a very, very long time because I was afraid that not only would they judge her, but they would also judge me. And so I felt that same shame that my daughter felt. I felt almost immoral. Like, how could somebody who has accomplished so much in their life do such a poor job of parenting? I really thought that I had done something horribly wrong in raising a child that ended up suffering from substance use disorder. I felt very weak. I felt like I could not take control of anything, that I didn't have the ability. And then that led obviously to a lack of control. I truly felt like I was going insane on a daily basis. Additionally, I would say that I also stopped doing all of the things that I love to do. I remember early on in my child's treatment, we took her to a state-of-the-art facility out of state. And when we first arrived, they gave my child a pie chart, and they had to list, all of the kids had to list how they had been affected in different areas of their life, educationally, emotionally, physically, spiritually, and there were like 10 different things on this pie chart, and our children filled those out. And then 5 days later, they gave that chart to the parents that were there. It was a 5-day program, and probably one of the best things I ever did for myself was to take that program. And we had to fill out that same pie chart. We did not know that our children had done it. And at the end of the session, they gave us both pie charts. And when we looked at them, they were mirror images. My daughter indicated that she loved to read. She stopped doing that. She loved cheerleading. She quit doing that. She loved family events. She stopped doing that. Mine said, I used to love to do physical things, kayaking, biking, walking. I quit doing all of those things. I quit reading. I'm a reader as well. I quit reading. I quit having family dinners. I am the matriarch in our family, and everything revolves around my house. And for months, I did nothing with my family because I was so focused on my sadness and on my shame. And so it affects people with substance use disorder with their healthcare professionals. A lot of stigma prevents people from seeking help. And so that's like programs like what we do, and I'll talk about that a little bit later. And ours isn't the only one. There are many programs across the state of Michigan that are helping to reduce that stigma of addiction and making it easy for people to ask for help. I know that we sometimes as professionals say, well, what's the deal? You know, they can just walk in at any facility and ask for help, but we all know that that really is not true. That it is a disease that really takes you to your knees and you feel very unworthy of help. And so without a compassionate team to help you navigate that system, your chances are pretty slim that you'll ever get into treatment. And that's really borne out by statistics. You know, we have only 10% of the people that suffer with substance use disorder actually access treatment. So that means 90% of people that suffer from substance use disorder never get into the system. And it's because the system is not user friendly, and we need to change that. And then it also damages your relationships with your family and your friends. I can tell you that clearly my daughter's relationship with our family was very much affected, and it was because of lack of understanding. We are historically, families are rarely ever included in the recovery process. Oftentimes my daughter would be taken behind closed doors and would receive therapy, and I would be sitting in a waiting room. You know, doctors, especially if your child is over 18, are not free to talk to you about your child's substance use disorders. So you're always playing a guessing game of what to do next. And when we're included in the recovery process, when we start learning about addiction and substance use disorders and why it's occurring, number one, the shame goes away. Number two, we can be a conduit to help our children in a better light. And a lot of the anger that we feel, the array of emotions that families go through is astronomical. I felt sad a lot. I felt ashamed a lot. I felt angry all the time. I was angry at God. I was angry at my child. I was angry at my family because I didn't think they would understand. I was angry at treatment facilities because they treated me poorly when I came in. I felt like I was ready to explode all the time. And if I was treated in a kinder way as I entered my experience through substance use disorder, I think I would have felt really different. And I know that's true for people that are seeking recovery. We receive letters all the time because of some programming that we do. And I will, like I said, I will talk about that a little bit later. And it's not really to push our programming, although we would love for all of you to use it and be familiar with it. But it's more to show you why we do what we do and how we're trying to erase stigma by what we do within Families Against Narcotics. Our behaviors as parents mirror the behavior of our children. We criticize people because they go down into very unsavory neighborhoods to buy their drugs. But I will tell you, as a parent, I cruised those neighborhoods looking for my children. And so it became my behavior as well. We start acting, we think substance use disorder causes insanity, but what parents do is insane. We start watching every move that our child makes. We want to keep them in a bubble so that that bubble protects them. And our parents, and they do the same. My child isolated during those use years as well. And so we start to mirror that same behavior. I never thought that I needed help. One of the treatment facilities that my child went to, I was not allowed to visit unless I did 6 recovery meetings on my own. And I was angry about that. I thought, I'm not the one with the problem here. I don't abuse substances. I've never used substances. So why am I being sent to recovery meetings? And it wasn't until I was into my 3rd meeting that one of the women there, it was the first meeting I spoke at, and I said, you know, I've been listening for 3 weeks now, and it seems to me like what you're telling me is that we're all being punished because we loved our children too much, gave them too much. And one of them looked at me and really calmly said, it's not that you love your child too much, it's that you need to learn to love her a different way. I never thought I needed to change my behavior to help my child. I did not realize I was doing anything wrong until I really began to educate myself about what my role was as far as drawing boundaries and establishing attainable boundaries that I could live with that would help move my child toward recovery. Self-care is really essential during the time that your child is going through addiction. We stop traveling, we stop going on trips, we stop taking breaks from life because we are so focused on saving a loved one that we forget that we're also suffering from this and that we need to take care of ourselves. So we developed a family coaching program that is offered free to anybody that comes through FAN that can help guide a family to recovery. I will tell you that the coaching I got, I did sign up for counseling with a counselor during my child's addiction, and he really was not a family counselor. He was an addiction counselor, but he understood what I was doing and understood the mirroring process that parents do. And he was my saving grace during my child's addiction. And so what we have done is we train people like me who have gone through this experience with a family member so that they can be peer family coaches for a family that is trying to navigate the system of addiction and understand it a little bit longer. We go through tremendous guilt as parents because we're so angry at our children all the time. And anger isn't something that you want to have be a lasting quality of your relationship with your child. And it wasn't until I really started understanding addiction that anger lifted and it became empathy, and it allowed me to start gaining control of my life again, which enabled me to help my child regain her life again. And so we really look at family coaching as a necessary thing that we provide any family that is going through the process of addiction with a loved one. And we provide these same things to people with substance use disorder, so we don't just focus on family. And I'll talk about that in just a little bit. But we try to help them understand their loved one's addiction. If I had $1 for every time I said to my child, "Why are you doing this to me?" which just added more shame and more guilt on her. You know, it wasn't anything that she was doing to me. She was suffering from a disease, but until I understood addiction as a disease, I blamed her for the suffering that I was going through. And so once I learned about addiction, I could see past my anger and what I was doing that played into this disease. We need to help them understand that their child is ill, that it's not a choice. Once again, if I had $1 for every time I said, "Why can't you just stop? You know what this is doing to you. You know what it's doing to us. You know what it's doing to your family. Why do you keep making this choice over and over and over again? I had no idea that her brain had changed and that it no longer was a choice for her. We help them support their loved one in a healthy way. We need to draw those boundaries as parents, and we need to stop rubber stamping behavior that keeps them in their addiction. We never want families to turn away from loved ones. We know statistically that people need a support system to find health again. And so we never want that pathway to be like, I'm not going to be part of your life any longer, but you can still draw that boundary in a healthy way. And we go through a process, a 3-month process of helping them support their loved one in healthy choices. I know that one of my favorite lines was with my child is we learned new ways to communicate, which is down a little bit further, but also with finding support in a healthy way. When my child was doing something that I knew was not healthy for recovery, my favorite line was, I can't support that behavior. You can't stay in my house if you continue that behavior, but I'm here if you choose recovery, if you choose a healthier path. I'm here to support that. I'm always going to be a part of your life, but you can't do this behavior in my home. We break down that barrier of codependence. Oh my gosh. I remember one of our recovering people with substance use disorder that helped start FAN said, there's only one person sicker than the person suffering from substance use disorder and in denial more than they are, and that is the parents or the person that loves that person. We've become so connected to that person at the core. I couldn't brush my teeth without thinking about my daughter. I wonder if she did that today. I couldn't go anywhere. I couldn't go on a trip because I was afraid that if I wasn't there to save her, that she would fall off the deep end. Everything that I did in my life for almost a 1 to 2 year period of my time centered around the reaction of my child. I also did not know how to communicate very well with her about the topic of addiction. It's hard to communicate about something that you don't understand. And so I would lecture her nonstop. And I ended up being one of those blah, blah, blah parents where I could see her eyes glaze over. And she wasn't listening to anything that I said, but I thought if I just kept saying the same thing louder and in a different way, that maybe my words would connect with her somehow. And I didn't understand that she needed treatment, an intervention, and that nothing I said was going to be strong enough to make her well. I really thought that if I could say the right words, that she would just stop. I had no understanding that all of my lecturing, all of my yelling, all of my talking compassionately wasn't going to change a single thing, that we needed to get her into treatment and we needed to help her find her path to recovery, and that was something I could not do for her. It was something I could lead her to, but it was not something that I could do for her myself. And then we need to establish and maintain healthy boundaries. It's really easy to establish boundaries. It's much harder to maintain those boundaries. I will tell you that it was not until I started really working on myself and I was no longer easily manipulated. I was no longer rubber stamping behavior that was literally destroying my life as well, that my child chose to get into recovery as well. And I hear people say that all the time. It's when my parent said that they weren't going to do this any longer was when I decided that I have nowhere else to go. I had to find help. So parents and loved ones can be instrumental in helping their child find recovery. It doesn't work 100 proof, I'm going to tell you that. We have a lot of families that are doing exactly what I'm telling you, and their child still has not found their pathway to recovery. But at least we are helping the family recover health at that point, and we're just praying that the child or the loved one will come along with them at some point in their life. It's really amazing that numbers, and I've really researched this, that we say that addiction, untreated addiction costs $510 billion in lost income and lost productivity in the criminal justice system. But that 510,000 does not even include the portion that is affected by parents. I took more time off of work during my child's addiction than ever before. There was lost things in like the travel industry, because I love to travel. If you know me, I love to travel. I did not ever go on vacation during this time. And so there are all these side things that are lost through addiction. And the families are a big part of that, but that's never included in any of these analysis that we do. The money that is spent on things that don't help. 2.3 million people are incarcerated in the United States. 65% of them met the criteria for substance use disorder, and only 11% had ever received treatment. We've come a long way, but we still have a long way to go with doing medically assisted treatment in jail systems. But still, it's not a system of care that involves the family, tries to reunite healthy union between families, and make the family be part of that recovery system. And we also need to realize that it doesn't stop once they're out of jail. We really need to set up systems of care that have extended period of time. My favorite thing to talk about at this point is how addiction mirrors cancer. You know, I used to really be naive. When my daughter went to her first treatment facility, we were lucky. She got to go for 30 days. We had really good insurance, and we were able to get a 30-day stay. And I really thought that she was going to come home and be fixed, you know, that would cure it. And so it wasn't until 3 years later and 7 treatment facilities later and many relapses that I realized that this is a disease that needs to be treated long-term. And it's why programs like, and we like to talk about how AA doesn't work, but they do have at least one part of that right, is that they continue to meet with people for their lifetime if need be. It's a long continuum of care and support that's provided to somebody with a substance use disorder. But we need to set up better outpatient exit programs from prisons, from hospitals, from treatment facilities, so that we're dealing with a person. We know that it takes at least a year for your brain to completely begin to heal from the effects of drug use, but there are very few programs that keep a person connected to treatment for up to a year. And it's really amazing, because we know that with cancer, if you hit that 1 year mark, those are really good odds. And I'm not sure what the statistic is there, but I do know that if you reach the 5 year mark with cancer, that you only have a 17% chance of ever having cancer again, at least in that same spot. The same statistics bear true of addiction. If you are substance-free for 5 years, there is only a 17% chance that you will relapse. And yet we do not have a system of care that provides that support for 5 years. We do for cancer, but we don't for substance use disorder. And it's an incredibly complex brain disease, and yet we don't have the same kind of treatment that is long lasting for extended periods of time. And I don't think that has to be intense, but it can be done through support systems so that that person is supported through those next 5 years, and that they have regular visits with their treatment provider, so that we make sure that behaviors are not starting to show up again that will lead them back down that road to substance use disorder. We need to change the language that we use to talk. And I know that many of you are sitting there saying, you keep using the word addiction. Don't you know that it's substance use disorder? But I think that we professionals that are working in the field need to use them interchangeably. until the general public gets used to it. I know when this first came out, I was doing all these talks to families and I was saying substance use disorder. And finally, one parent raised her hand and said, "What are you talking about?" And my child is suffering from addiction. And I said, those are the same terms. We're trying to change the language so that we're not using negative language. So we need to be cognizant of the fact that we need to do this so that the public catches up with what all of us know. We need to offer compassionate support. That is something that I did not receive when I was going through this. And I can tell you, it was not something that my daughter received it. When we first started a program that we do called Hope Not Handcuffs, we did a survey of several people and asked them, if you were going to walk in and just ask for help at your worst moment, would you be more willing to go to a hospital or would you go to a police department? And 100% of those people said they would be willing to go to a police department over a hospital. I think that tells you about the treatment that they get when they do overdose or when they enter a hospital because of this. And so that really said a lot to me about what we're doing in the field that would make people feel that kind of stigma on a regular basis. We need to display kindness to people that are in vulnerable situations. I know in my early years as a judge, I was not nice to people with substance use disorders. I did not see the goodness in them. I did not realize that their substance use disorder was masking who they were as a person. And so we need to be really careful that we provide support during those situations and that we do not further the stigma and the shame that they're already feeling. We need to see the person for who they are, not the drug that they use. And that was a really big one for me. I used to look at my daughter and think, are we ever going to be able to have a conversation that does not center around your disease or your problem back then? And I never could see that she was still the same person that she was before she started using substances, which was a kind, lovely, caring individual with lots of potential. I only saw her for the drugs she was using at that time, and it's really hard to separate those two things, but we need to hate the drug, not the person. And we need to listen to them withholding judgment. I'm not a good listener, I'm a good talker. And that's one of the skills I had to really, really focus on, was listening to what she was needing from me rather than what I needed from her. And so we need to really listen to what people with substance use disorder are saying. We oftentimes develop programs and we don't use them as a part of that program to tell us what would have been beneficial to you back when you were using. And we try to do that in all of our programming. And we try to treat SUD patients with dignity and respect. I remember a story, and one of the reasons that I got so involved in this stigma thing is we had a local television station that was going to promote our Run Drugs Out of Town, which is one of our big fundraisers. And they wanted a real person with a real story. And we had a young woman that was working for us at the time who had really never shared her story publicly, but she was 3 years into recovery and was feeling really good about herself. And she said, "Can I go do that?" And I said, yes. And she was really nervous about it. And she did an amazing job. She painted the most beautiful picture of recovery that you could have ever hoped for, provided lots of hope, lots of encouragement to people that were suffering from substance use disorder, that they could in fact get well. But when the television program aired, it made her feel awful. It totally destroyed her self-esteem for a short period of time. And fortunately that she was strong enough that she was able to realize that it was lack of education that caused that. But they would use her voiceover about, and they only talked about the parts that she talked about her addiction, never about her recovery. And they showed people laying in gutters with needles in their arms and all of the negative things that we think about when we talk about substance use disorder. And so she did not want to share her story anymore. And she's got past that. And she's now working in the field with GDAC to change a 3-county area and how we look at it. And one of the things that we are working on at FAN and with GDAC is to develop a media tool on how we can teach media to do better with diminishing stigma in the reporting that they're doing. And then we really need to do our research and learn about drug dependency. It really amazes me how many people I even talk to in the treatment world that truly do not understand drug dependency. The judgment that they have, the negativity that they have about what they're doing. I clearly see it in the medical field. And I see it with police officers. And so it's up to all of us that work in the field to really develop programs, training programs that begin to diminish that stigma among the groups that are constantly promoting it. Because if we do that, we know that stigma is the #1 barrier to treatment. We're going to continue to have 11% of people accessing treatment instead of 100%. What can we also do is we need to stop using hurtful labels. One of the things, and I do this every time I talk to judges, is that we use clean and dirty to describe blood tests or urine tests. And boy, that I never thought about it, but when you tell somebody they have a dirty drug screen, boy, is that ever shaming language. I never thought of it in terms of that until I heard somebody else talk about abusive and hurtful labels. We would never say someone that had cancer cells that reoccurred and they drew their blood that, well, your blood is dirty again. We would tell them that their disease has reoccurred, and we need to start replacing language with more positive language when we talk with people and quit labeling people with negatives like abuser, junkie, dirty, clean, and the list could go on and on. And we need to replace attitudes with evidence-based facts. And I know that a lot of you work in the world of treatment. I had a big stigma about medically assisted treatment, and we need to understand that we need to educate the public, that we need to change the attitudes around it so that we can replace those attitudes with evidence-based facts that people who are sick normally need treatment and medications to get well. Addiction is no different. We need to really wrap our arms around the fact that we're not telling people to pop a pill and you'll get better, but we are telling them that if you take medication along with all of the other modalities on a long-term basis, you do have a real good chance of recovery. And we need to speak up when you see someone being mistreated of their substance use. When the young woman I told you about told me how she made the news media cast made her feel, I didn't just sit back and let that happen. We called that news reporter, and that news reporter is now part of our team that is helping to develop that media kit. We need people that have mistreated to become part of the process, and we need to ingratiate them in the process. So if they change their behavior, it leads to the next group changing theirs. And we need to use person first language. We don't just say, he's a junkie. We talk about a person with a substance use disorder, an adolescent with an addiction, an individual engaging in risky or risky use of substances, instead of just labeling those people again. I want to talk a little bit about our program, Hope Not Handcuffs, not to promote it, although it is in a lot of your areas and is a conduit for people to find help. But one of the reasons we developed this program was to reduce stigma. We really wanted to make it easy for people to get treatment. And I will tell you that I, as a parent, realized how difficult it was to access treatment. I didn't know where to call, and I worked in the system. So we cannot expect people who their brain has been hijacked by drugs and alcohol to have the wherewithal to easily access and find treatment. So with this program, and I'm not going to spend a lot of time on it, I just want to talk about how we use it to reduce stigma. You walk into a police department, you ask for help. That officer treats you with kindness, gives you something to eat, a bottle of water, some clean clothes if you need them, something to snack on, calls an angel who then shows up and treats you very compassionately and begins the process of finding you treatment and help. And if we have one, we have 1,000 letters that have been written to us that saying, I've never been treated that kindly in my life. I've been in and out of treatment many times. I think this one will work because I feel like I have a whole team that is supporting me now. So we wanted to provide a team that provided support for individuals, not just got them into treatment. And so we now assign a peer recovery coach, a family coach to the people that are entering our program. We work with them for up to 6 months, and then we continue to have contact with them. We create programming called Hope Heroes for people that have gone through the program, that their family and friends can come and get together, kind of regroup, connect with people that are staying in recovery to make sure that they have access to a support system on a long-term basis. We have placed over 4,500 people. This is dated right now. We work with 125 police agencies in Michigan and in the state of New York. We're in different, 10 different counties. And we have over 800 volunteer angels that work within this program. We educate every single one of those people so that they begin to reduce stigma in how they approach the person with substance use disorder. So it's not just about the person with the substance use disorder, it's about educating everybody that touches that person. We also last year created a program called Comeback, the Quick Response Team. This is a wellness check that we do with police officers where after an overdose, at an overdose, they leave this card. And I want to tell you that after Andrea's story about the media thing, we went back and redid all of our marketing materials because we had needles and pills on the covers of our brochures. And we really painted a picture of recovery on all of our marketing. So I would encourage you to go. One of my favorite stories is I was asked by one of our treatment facilities to be a guest speaker. And I have a lot of respect for this facility. They do a great job. And they asked me to speak about addiction. And I started out the speech because they had their big logo behind me. And it was what I just described to you of someone with a needle in their arm and pills all over the place. And I said, so I'm here to talk to you about stigma. And we do it without really meaning to. And I'm saying this with the utmost respect for this treatment facility because we work very closely with them and they do a wonderful job. But their logo is full of stigma. And we in the industry need to change the way we're helping people see addiction if we expect the average person to change their perception. So while I was talking, they had a person with their hands spread up, standing on top of a mountain. And they changed their logo to encourage hope and respect and compassion. And that has now become their new logo on their marketing materials. We at FAN did the same thing. So I never point fingers without also pointing at our organization and the way we have progressed and changed over years. When we see that we're doing something that perpetuates it, we really try to change our behavior as well so that we are mirroring what we talk about. So this was the card that we leave at every overdose. We almost lost you. This time it was a little more than your body could handle. You probably never expected it to happen. We understand and you matter to us. In the next couple of days, a few kind people are going to stop by to make sure you're okay. Why? Because you're worth it. When they show up, there's no need to worry. You'll be treated with compassion and respect and offered help and resources that you deserve. It's never too late for a comeback. We wanted to leave something with people and their families, and then we leave a whole packet of information of things in our community that are available for families and for people with substance use disorder, how they can easily access treatment. And then within a 72-hour period of time, we make a house call and we take Hope Not handcuffs right to their doorstep. We didn't know how this program would work. You never do when you try something new and innovative. And this was not our brainchild. It started in Ohio. It's in West Virginia now. They're doing it in some of the eastern states, out in Boston. We visited all those places, learned from them, and then devised a program that we thought would work well within our state. But the message we wanted is that you are worthy of being helped, and we want to be part of that. And we use police officers to do that, because right now, more than ever in our country, we need good community policing. We need officers that understand that addiction is a disease, not a moral failing. We need officers that will change the face of addiction to be an illness rather than a crime. And if we involve them in a process, one officer at a time changes. And we've seen that through all of our programming. Doing comeback was really easy because officers love the way Hope Not Handcuffs works, and they saw the real benefits of it. I remember a story that one of our officers told that we call repeat offenders as judges that come back through your court all the time. Well, he was a repeat offender in this local police jurisdiction, and he had been coming in for years with new crimes all around substance use disorder. And they said that, we just really had given up on this guy. It's like, you're back again, you're back again. They were very negative. Well, one of the times he was released from jail, he walked to the front and said, "I'm here for Hope Not Handcuffs. Do you think I can get well?" And the officer said, "Yeah, anybody can get well if they want to," and hooked him up with an angel. We connected him with one of our long-term people that kind of matched what he had been doing with his life as a peer recovery coach. And 6 months after that, the guy walked back into the police department with a suit on. He had the first job he had had in years and years of his life, and he thanked the police officer. And those officers were one of the first police departments that volunteered to do the comeback program with us, because they see that when their attitudes change, it can really make a difference in the work that they do. We see a lot of negative about police officers, but I will tell you, I work with police officers all over the state that really do want to get this right and be part of the process that provides hope and understanding rather than locking people up. And we need to embrace that and bring more people into that fold. Do you have any questions? I think we have about 6 minutes left. If you have any questions about anything that I said, I would be glad to answer them at this time.
Thanks, Judge Davis. We actually do have a few questions.
Okay.
One of the first ones is, do you look at marijuana and vaping, for instance, for 16-year-olds, the same as opioids and heroin addiction?
I think that any substance that is abused and used in a way that interferes with your life is an addiction. Do I think well, I think vaping can be deadly. There's lots of comparison, and this could be a whole hour talk in itself. But I think we need to realize that as young people begin to understand that marijuana is legalized now, they are going to see it as less dangerous than it might really be for their young developing brains. And I really think we need to educate our community that this does change brain chemistry, just like any medication does. We call it medically approved in the beginning, but medications change brain chemistry. That's what they're designed to do. And that when you start working on your brain, changing your brain chemistry at a younger age, you are much more susceptible to addiction as you're getting older. So the answer to that is they're not the same, but I think they can lead into addiction and become very addictive.
Okay, thank you.
Okay.
Next question is, we have a lot of first responders watching today, including EMS personnel. And you had mentioned the role of law enforcement. If you could just speak a little bit about the role and your thoughts on EMS paramedics who are responding to these calls, sometimes repeatedly within a short amount of time.
Right. We do programming with the EMS as well. And we are working in different areas, but we try not to step on toes because a lot of the EMS people are also doing a similar programming where they are being community EMS and going back out to households of people that have overdosed. But we would love to bring them into the fold. I think any profession, and I want to make this really clear. I'm not bad-mouthing any of the professions. I understand why hospitals get fed up dealing with people with overdoses. I understand why police officers do. I understand why EMS gets sick and tired of going back to the same overdoses over and over and over again. I understand why judges make those judgment calls and we get sick of dealing with the same people, but I have to remind myself all the time that we are dealing with people at their very worst. And it goes back to that thing I said of seeing the person for more than their addiction. When you start talking to people about what their dreams, what their aspirations were, who they were before their addiction, you will find that most people never in their wildest imagination thought that they would be in the situation that they're at with you right now. But that takes a constant checking of yourself. I know the last years that I was on the bench, about the last 8 years, I really changed my attitude. I tried to see hope in people, and strength in people instead of their weakness. And that oftentimes was the conduit to get them help. And so I think that we need to do a lot of training with EMS and make them part of the process. And I know there is a lot of training that's done. I think they have an incredibly difficult job. And we would be glad to work with EMS. We have a lot of training procedures that we do around stigma. And I think that our frontline workers really need to be the best educated of all of us, because they have that first encounter oftentimes with an individual and can really be that conduit, that moment of clarity that somebody needs to be the conduit to get them help.
Thank you. We have time for one more question. Someone had asked, what type of additional aftercare programs do you suggest that could support a person at maybe the 5-year mark of recovery?
I just think that we need to encourage them to be involved in groups. That there are a lot of really wonderful, like I know out in Lansing, it's nothing to do with FAN, but they have a whole recreation system that's set up where they get together and they play sports. I think connecting them with groups that are doing fun things without drugs and alcohol can be really beneficial to people that have suffered from an addiction. They oftentimes lose their group of friends. And so I think it's really important to provide those services. I think that, that peer recovery coach, I know that we think that initial encounter with people, but if we had a system that even once a month, the peer recovery coach could be paid to reach out to individuals to let them know they're being thought about still, check in with them, make sure that they're doing great, set up aftercare visits for a longer period of time once they leave or exit treatment facilities. That would be helpful in keeping people and maybe catching them before they get off the tracks again if they're starting to struggle again. We know this is a lifelong disease. We need to treat it like that.
Thank you, Judge Davis. So we have a lot of other questions. Unfortunately, we're getting short on time. So we're going to go ahead and start the wrap up. Very first of all, we want to thank you, Judge Davis, so much for all of your knowledge, your firsthand experience, and all your information today. It was absolutely fantastic having you. Thank you.
Thank you so much. It was a pleasure.